Question 1. A nurse is caring for a patient in the moderate stage of Alzheimer's disease. Which activity should the nurse prioritize to maintain the patient's independence? A. Perform all activities of daily living, ADLs, for the patient. B. Encourage the patient to complete ADLs with supervision. C. Assign total care to unlicensed assistive personnel. D. Place the patient in bed to prevent wandering. Answer. B. Encourage the patient to complete ADLs with supervision. Question 2. A patient with Alzheimer's disease is frequently wandering at night. What is the most appropriate nursing intervention? A. Apply physical restraints during nighttime. B. Administer a sedative every night. C. Install a motion sensor alarm. D. Lock the patient's room door. Answer. C. Install a motion sensor alarm. Question 3. The nurse is assigning tasks on a dementia care unit. Which task is most appropriate for a licensed practical nurse, LPN? A. Develop a care plan for a new Alzheimer's patient. B. Administer enteral feedings to a patient with Alzheimer's. C. Perform initial admission assessment. D. Teach the family about disease progression. Answer. B. Administer enteral feedings to a patient with Alzheimer's. Question 4. A caregiver reports that an Alzheimer's patient has started becoming aggressive during bathing. What is the nurse's best action? A. Avoid bathing the patient entirely. B. Instruct caregiver to restrain the patient during bath time. C. Schedule the bath at a time when the patient is calm. D. Administer antipsychotic medication before bathing. Answer. C. Schedule the bath at a time when the patient is calm. Question 5. A newly admitted patient with advanced Alzheimer's disease is at risk for aspiration. Which meal should the nurse provide? A. Chicken noodle soup and crackers. B. Steak with mashed potatoes. C. Pureed vegetables and thickened liquids. D. Toast with peanut butter and orange juice. Answer. C. Pureed vegetables and thickened liquids. Question 6. During morning rounds, a nurse finds an Alzheimer's patient agitated and confused. What should the nurse do first? A. Restrain the patient. B. Reorient the patient using a calm voice. C. Notify the physician immediately. D. Ignore the behavior unless it escalates. Answer. B. Reorient the patient using a calm voice. Question 7. Which task can the nurse safely delegate to an unlicensed assistive personnel? UAP, caring for a patient with Alzheimer's. A. Teach memory enhancement techniques. B. Perform a mini-mental state examination. C. Assist with feeding and toileting. D. Evaluate the patient's pain level. Answer. C. Assist with feeding and toileting. Question 8. Which behavior in a patient with Alzheimer's disease requires immediate intervention? A. Repeatedly asking the same question. B. Wandering aimlessly in the hallway. C. Attempting to remove 4 tubing. D. Forgetting names of family members. Answer. C. Attempting to remove 4 tubing. Question 9. A nurse notices a family caregiver becoming frustrated while caring for an Alzheimer's patient. What is the best nursing action? A. Tell the caregiver to be more patient. B. Recommend respite care services. C. Suggest the caregiver ignore the patient's behavior. D. Instruct the caregiver to increase the patient's medication. Answer. B. Recommend respite care services. Question 10. A patient with Alzheimer's disease is incontinent. Which intervention should the nurse implement? A. Insert an indwelling catheter. B. Limit fluid intake to reduce accidents. C. Establish a toileting schedule. D. Use adult diapers without further intervention. Answer. C. Establish a toileting schedule. Question 11. The nurse is planning care for a patient in the severe stage of Alzheimer's. Which goal is most appropriate? A. Improve memory recall. B. Promote self-care independence. C. Maintain safety and prevent injury. D. Engage in complex conversations. Answer: C. Maintain safety and prevent injury. Question 12. Which is the most appropriate room assignment for a newly admitted Alzheimer's patient prone to wandering? A. Near the nurse's station with low stimuli. B. In a private room with a television. C. Next to the kitchen to reduce confusion. D. Far end of the hallway for privacy. Answer: A. Near the nurse's station with low stimuli. Question 13. An Alzheimer's patient with difficulty swallowing is refusing to eat. What is the nurse's priority action? A. Document the refusal and try later. B. Provide a nutritional supplement. C. Perform a swallow assessment. D. Consult dietary for alternatives. Answer: C. Perform a swallow assessment. Question 14. A nurse is teaching family members how to care for a loved one with Alzheimer's disease. Which instruction is most helpful? A. Provide multiple choices for meals. B. Use long explanations to clarify confusion. C. Maintain a consistent daily routine. D. Challenge the patient's memory regularly. Answer: C. Maintain a consistent daily routine. Question 15. A UAP tells the nurse that an Alzheimer's patient is repeatedly trying to leave the facility. What is the best response by the nurse? A. Instruct the UAP to ignore the behavior. B. Apply a vest restraint. C. Redirect the patient to a safe activity. D. Call security to lock the doors. Answer: C. Redirect the patient to a safe activity. Question 16. The nurse prepares to administer medication to a patient with Alzheimer's who is suspicious and refuses to take it. What should the nurse do? A. Forcefully give the medication. B. Leave the medication at the bedside. C. Explain the medication calmly and offer again later. D. Mix the medication into the patient's food without consent. Answer: C. Explain the medication calmly and offer again later. Question 17. Which task should the nurse delegate to a UAP when caring for a patient with late-stage Alzheimer's? A. Monitor for swallowing difficulties. B. Ambulate the patient with assistance. C. Assess for signs of depression. D. Plan diversional activities. Answer: B. Ambulate the patient with assistance. Question 18. A nurse is evaluating a care plan for a patient with Alzheimer's disease. Which outcome is most realistic? A. Patient will independently manage all ADLs. B. Patient will demonstrate full memory recovery. C. Patient will remain free from injury. D. Patient will regain ability to perform complex tasks. Answer: C. Patient will remain free from injury. Question 19. A patient with Alzheimer's has become more withdrawn and irritable. What should the nurse assess first? A. Level of family involvement. B. Medication side effects. C. Nutritional intake. D. Potential for pain or discomfort. Answer: D. Potential for pain or discomfort. Question 20. When educating staff about Alzheimer's disease, the nurse emphasizes which point as most important for communication? A. Ask complex questions to stimulate memory. B. Use short, simple sentences and repeat as needed. C. Correct every incorrect statement by the patient. D. Talk to the patient loudly and quickly. Answer: B. Use short, simple sentences and repeat as needed. Question 21. Which is the most appropriate strategy to reduce the risk of falls in a patient with moderate Alzheimer's disease? A. Keep the patient in bed throughout the day. B. Use bed alarms and keep frequently used items within reach. C. Encourage the patient to walk alone to maintain independence. D. Use physical restraints during peak confusion hours. Answer: B. Use bed alarms and keep frequently used items within reach. Question 22. Which statement made by a caregiver of a patient with Alzheimer's indicates a need for further teaching? A. I should give simple one-step instructions. B. I can reorient him using a clock and calendar. C. I will correct him every time he forgets something. D. I should keep the home environment consistent. Answer: C. I will correct him every time he forgets something. Question 23. A patient with Alzheimer's begins having visual hallucinations. What is the nurse's best action? A. Tell the patient the hallucinations are not real. B. Ask the patient to describe what they see. C. Turn off all lights and stimulation. D. Encourage the patient to ignore the hallucination. Answer: B. Ask the patient to describe what they see. Question 24. The nurse is preparing to discharge a patient with Alzheimer's to home care. What safety teaching should be included? A. Use scatter rugs to prevent slipping. B. Keep cleaning supplies unlocked for access. C. Install door locks high or low to prevent wandering. D. Allow full access to kitchen appliances. Answer: C. Install door locks high or low to prevent wandering. Question 25. UAP reports that a patient with Alzheimer's is having trouble dressing. What should the nurse instruct the UAP to do? A. Dress the patient completely without involvement. B. Leave the patient alone to figure it out. C. Offer clothing choices and assist as needed. D. Remove all mirrors to avoid confusion. Answer: C. Offer clothing choices and assist as needed. Question 26. Which dietary modification is most appropriate for an Alzheimer's patient with poor attention span during meals? A. Serve several different food items at once. B. Provide one food item at a time. C. Allow the patient to eat independently in a busy area. D. Eliminate meals and use only supplements. Answer: B. Provide one food item at a time. Question 27. A nurse is evaluating the effectiveness of a reminiscence therapy session for a group of Alzheimer's patients. Which observation best indicates success? A. Patients become tearful and upset. B. Patients fall asleep during the session. C. Patients are engaged and smiling. D. Patients refuse to participate. Answer: C. Patients are engaged and smiling. Question 28. Which behavior suggests a patient with Alzheimer's is experiencing sundowning? A. Becoming more alert and social in the evening. B. Displaying increased agitation and confusion at dusk. C. Sleeping through the entire day. D. Exhibiting improved memory at night. Answer: B. Displaying increased agitation and confusion at dusk. Question 29. A nurse notices an Alzheimer's patient hoarding food in their room. What is the best nursing intervention? A. Scold the patient for hiding food. B. Confiscate all food and lock the drawers. C. Acknowledge the behavior and monitor for safety. D. Remove all snacks permanently. Answer: C. Acknowledge the behavior and monitor for safety. Question 30. The family of an Alzheimer's patient asks about prognosis. What is the nurse's most accurate response? A. Alzheimer's is curable with proper medication. B. Alzheimer's progresses slowly and is irreversible. C. Your loved one should return to normal in a few years. D. Alzheimer's does not worsen beyond early symptoms. Answer: B. Alzheimer's progresses slowly and is irreversible. Question 31. What is the most effective way for a nurse to reduce anxiety during bathing in an Alzheimer's patient? A. Use firm commands to speed up the process. B. Provide detailed instructions and explanations. C. Use calm voice and familiar routines. D. Skip bathing on difficult days. Answer: C. Use calm voice and familiar routines. Question 32. The nurse finds an Alzheimer's patient trying to exit the building. What should be done first? A. Physically block the exit. B. Redirect the patient calmly to a supervised area. C. Yell to get the patient's attention. D. Call the physician immediately. Answer: B. Redirect the patient calmly to a supervised area. Question 33. An LPN is caring for a patient with Alzheimer's who has developed a new cough and fever. What should the RN assign to the LPN? A. Administer 4 antibiotics. B. Assess lung sounds and report findings. C. Develop a new care plan. D. Provide education on infection prevention. Answer: B. Assess lung sounds and report findings. Question 34. A nurse notices an Alzheimer's patient frequently clenching their fists and grimacing. What should the nurse suspect? A. The patient is angry. B. The patient is experiencing pain. C. The patient is hallucinating. D. The patient is being defiant. Answer: B. The patient is experiencing pain. Question 35. Which activity is most suitable for a patient in the early stages of Alzheimer's disease? A. Completing a 100-piece puzzle. B. Watching unfamiliar news channels. C. Folding towels and sorting silverware. D. Learning a new language. Answer: C. Folding towels and sorting silverware. Question 36. A patient with Alzheimer's begins shouting and hitting staff. What should the nurse do first? A. Call for security immediately. B. Administer sedatives without delay. C. Identify and remove possible stressors. D. Physically restrain the patient. Answer: C. Identify and remove possible stressors. Question 37. The family asks if their loved one with Alzheimer's can still make decisions. What is the nurse's best response? A. The patient can't make any decisions anymore. B. Decision-making ability may depend on disease stage. C. Only legal guardians can now decide everything. D. All decisions must now be made by medical staff. Answer: B. Decision-making ability may depend on disease stage. Question 38. Which environmental modification can best support safety in an Alzheimer's unit? A. Place mirrors in every room. B. Display old photographs on walls. C. Use dim lighting throughout the day. D. Hang abstract paintings for stimulation. Answer: B. Display old photographs on walls. Question 39. An Alzheimer's patient with a urinary tract infection suddenly becomes more confused. What is the best interpretation? A. The disease is progressing rapidly. B. Confusion is unrelated to the infection. C. This is a normal aging process. D. The infection may be causing delirium. Answer: D. The infection may be causing delirium. Question 40. Which intervention should the nurse avoid when communicating with a patient with Alzheimer's disease? A. Speaking clearly and using gestures. B. Asking simple yes or no questions. C. Giving multiple instructions at once. D. Allowing time for the patient to respond. Answer: C. Giving multiple instructions at once. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.